Good evening, everyone. I want to welcome you and thank you for joining us for Queen's Free Speaking of Health lecture series tonight. My name is Lisa Sakia. I'm with Corporate Communications, and on behalf of the Queen's Health Systems, I welcome you all this evening. We are here to learn about stroke. Tonight's lecture is called Simple Ways to Prevent Stroke. And now it is my privilege and honor to introduce you to our speaker this evening, Dr. Kazuma Nakagawa. Let's give him a warm round of applause. He is a neurointensivist and stroke neurologist. He is the medical director of Queen's Obstetric Neurovascular Service, and just this month, he became the director of the Queen's Comprehensive Stroke Center. Originally, we were a primary stroke center, so we became recently a comprehensive stroke center. What does that mean? That means there are 100 hospitals in the entire nation, and we are one of those hospitals that can provide, we are certified by the Joint Commission to treat the most complex stroke cases. Queens is, we want to say congratulations to Dr. Nakagawa for his new role as director. So where did it all start? For him, it started educationally wise at Cornell University, where he got his Bachelor's of Science. Then he went to the University of Florida for his Doctor of Medicine degree. He received his neurology training at the Harvard Neurology Residency Program at Massachusetts General Hospital and Brigham and Women's Hospital. He then went to the University of California, San Francisco for a neurocritical care and neurovascular fellowship. He has approximately 40 peer-reviewed publications, mostly focused on ischemic and hemorrhagic stroke. He is an associate professor of medicine at the John A. Burns School of Medicine. He is the current president of the American Heart Association Hawaii Division and was just awarded the 2017 Physician Volunteer of the Year Award by the American Heart Association Western States Affiliate. We are pleased to have Dr. Kazuma Nakagawa.
Good evening, everyone. First of all, thank you so much for coming tonight for this talk. And I'm very shocked and honored to see this many people. It's probably one of the biggest audience I've had recently. Hopefully by the end of this talk, you'll take away some couple of important new knowledge and some simple ways to prevent stroke. I'm running the neuro ICU this week, and I just rushed out of the ICU, taking care of a 42-year-old woman with a hemorrhagic stroke, comatose, on the verge of becoming brain dead, all from high blood pressure, and she's 42. And it's real, it's out there, and it can happen to very young people. So, let's start off by saying, asking, so what is a stroke? Just like heart attack is a medical emergency, stroke or brain attack is also a medical emergency. This occurs when there's a sudden loss of blood flow to one area of the brain. And depending on the location and size of the blockage, the stroke severity can range from anywhere from mild deficit to something very severe and disabling and potentially fatal. And since brain is very delicate, it's a delicate organ that really needs oxygen and blood flow. So you can start to get a permanent damage very quickly if you don't get enough blood flow to that part of the brain. And you can lose approximately 2 million brain cells every minute during stroke. And we have about 100 billion brain cells in our brain. So that's a lot. And since stroke damage parts of the brain permanently, it's the leading cause of adult disability in the United States. But the good news is 80 to 90% of the stroke is considered preventable, completely preventable. So if everyone did the right thing, not the right thing, but healthy lifestyle and did everything, then 80 or 90% of the stroke that we typically care for can be completely eliminated. You can see in this brain anatomy diagram how complex the brain is, and depending on which part of the brain gets damaged from the stroke, you get a different neurological deficit. So you can get an isolated or a combination of symptoms, including paralysis one side of the body, or numbness, or difficulty with speech expression or comprehension, or sometimes you get a huge blind spot where you can't really see like one side of the whole vision. We can have a problem with balance or clumsiness and memory and so on. Like I said earlier, just like a heart attack, stroke is a brain attack, so it occurs really fast. And this occurs when you have a blockage of that artery supplying that part of the brain. So that part of the brain where you see a little bit of the grayish hue, I don't know if you can see, just stops getting blood flow and oxygen, and that tissue starts to die very quickly. So as a result, this leaves someone with a profound disability. And all of a sudden, this person's quality of life was taken away just like that. And the entire life has gone upside down. Here you can see this wide range of permanent disabilities 6 months after a stroke. Almost half the people still have hemiparesis, which is a weakness or paralysis of one side of the body. And about a third of the people still can't walk, ambulate without assistance, and are considered dependent and disabled. About a quarter of the stroke survivors are institutionalized to a nursing home. From a public health standpoint, the estimated direct and indirect costs spent towards the care of stroke patients are astonishing and can range anywhere from $20 to $40 billion per year. And this is where our tax dollars going. In the United States, stroke used to be the third leading cause of death for a long, long time, until over the last few years, it's been declining and has dropped to number 4 cause of death and now down to number 5 cause of death over the last few years. And this sudden decline is likely due to these various health intervention initiatives that are taking place across the country. The bad news is, in Hawaii, a stroke still remains the third leading cause of death. So we're lagging behind to the mainland. And to give you a global perspective, stroke is the second leading cause of death, right behind heart disease. And here you can see the top 10 leading cause of death in the world. And you can see that stroke mortality is right behind ischemic heart disease. Earlier I mentioned that a stroke occurs when the blood clot blocks the blood vessels supplying to the brain, bringing oxygen to the brain. So where does this clot come from? It could come from the heart. So the heart forms a clot and get dislodged, and the clot just travels up the blood vessel and gets stuck in the brain. That can happen. Or the clot can come from the aorta, which is the main pipe right above the heart. And then sometimes a cholesterol plaque that's sort of hanging out there can get dislodged and go to the brain. Other common situation is that the cholesterol plaque builds in the carotid arteries in the neck can also get dislodged or forms a complete occlusion there. And sometimes the small little blood vessels within the brain can also get blocked as well. The key to remember is that the mechanism for this blockage at each of these locations is very different, and the prevention strategies are a little different as well. So it's important to see the specialist to see what caused the stroke, and that's what I do. When someone has a stroke, I determine how did that happen, and make sure that we tailor the prevention strategy based on the location of the stroke. So you can see how the clot can potentially come from, but how does this clot and sort of cholesterol plaque forms? The most common process of this clot formation is a process called atherosclerosis. And atherosclerosis is essentially a cholesterol buildup along the blood vessel wall that happens over time. But everyone gets so focused on cholesterol, but it's really not, that's not the main issue. The high blood pressure that occurs for many years causes wear and tear along the blood vessel wall. That happens first, causes a little wear and tear and breakdown, and that little breakdown causes the cholesterol to stick, and then it kind of builds up and snowballs, and then it becomes the complete blockage. Another way of forming a clot is sometimes you form a clot inside the heart. You can see in this diagram that heart itself is a very complicated structure with a lot of little pockets and divots, and it's not so smooth. So the clot, blood is like a lava. It's like thick and it sort of like flows very sluggishly. And if it's moving, it stays as liquid. But if it slows down, it forms a clot. So if you have a small little pockets within the heart that get stagnant, that blood can clot off. So if you have a heart failure, cardiomyopathy, where the structure of the heart gets changed, or if you have a certain irregular heart rhythm where the heart just quivers like this instead of having a good contraction, that forms a little stagnant sort of pool where the blood can clot. So this is another way of forming a clot, causing a stroke. So what are the warning signs of a stroke? Although many stroke symptoms can be complicated, you can remember this simple mnemonic, which is FAST. So F stands for facial droop, A stands for arm drift. So if your arm just starts to drift or gets clumsy. S stands for slurred speech, so any kind of a speech problem. And T is time, really emphasizing the time is brain. Every minute counts. Every minute is 2 million brain cells. Call 911 because if you try to drive yourself in or have your family drive them in, it's going to cause a lot of delay to care. Okay, so that's just the background of what the stroke is, and we're going to talk about some of the risk factors. So first, I'm going to talk about the medical risk factors, okay? So what are some of the medical risk factors that would increase your risk of stroke? So here's the list. So the number one, the most important risk factor is high blood pressure. And then the rest is sort of equivalent. Diabetes, high cholesterol, atrial fibrillation, which is irregular heart rhythm, congestive heart failure, and the new thing is obstructive sleep apnea. I'm going to talk about that a little bit later, but if you hear sleep apnea, you're like, how does that going to cause a stroke? But it does. So if you have any of these conditions, the main thing is that you should see your primary care doctor and optimize these conditions, but that's going to really cut your risk of having a future stroke. And I really want to emphasize what's important. I say here, pick your battle. If you have all these stroke risk factors, let's say high blood pressure, diabetes, cholesterol, not eating fruits and vegetables, smoking, and alcohol use, I want you to conceptualize like what's important and sort of put a bar graph or weight on which one's number one, how much importance, because we often hear about on the TV ad, like, cholesterol medication or diabetes medication and whatnot. We hardly hear about other factors. Here's the truth. High blood pressure is by far the most important risk factor for stroke. It has 10 times more weight than cholesterol issue or obesity or even smoking. So, so smoking has about 4 to 5 sort of points for the stroke risk, whereas high blood pressure is like 50 points. Okay, this is eye-opening. And we often don't talk about blood pressure that much. We kind of write it off because it doesn't hurt us, it doesn't bother us. We can walk around with a little bit of high blood pressure. And here's another graph of correlating the risk of stroke over time and your systolic blood pressure, which is the top number. So it basically shows you that the risk of stroke, which is on the y-axis, almost doubles, quadruples, and so on, for almost every 10 points in blood pressure. So if you're walking around with a blood pressure of like 160, your chance of having a stroke is 4 times more than if your blood pressure were to be in the 130s or 120s. And it's that simple. It's just by doubling your blood pressure medication, doing the right thing, exercising, cutting down your salt. Same thing for the diastolic blood pressure, which is a lower number, which has exactly the same linear correlation. The higher the number is, the risk of a hemorrhagic stroke or ischemic stroke goes up. I like to keep things simple, and the analogy I give to my patient is that our blood vessels are like plumbing system. And if you keep the water pressure low, there's less damage to the pipes over time. But if you run the water pressure high all the time and mix some high cholesterol oil in there and put some unhealthy diet, and then if you have like diabetes, your pipe's going to get corroded and eroded really fast, and it's going to look like that really fast. So basically, you want to keep your pipes in your body looking brand new as possible, so that's going to last for many, many years. If you don't, it's going to cause leakage or blockage really fast. It's that simple. To give you a perspective of how important and how powerful or impactful the blood pressure control is on stroke, here are some facts. People with blood pressure less than 120/80 have about half the lifetime risk of stroke, those with hypertension. And then lowering the systolic blood pressure by 10 points, just 10 points, bringing down from, let's say, 150 to 140 or 140 to 130, just by that, you reduce your risk of stroke by more than 40%. Okay? That kind of effect is way more powerful than whether you're on Plavix or aspirin or all these Lipitor and this and that. That kind of, if you look at the graph, the benefit you get from being on certain medications is much lower than this 40% you get. But we don't talk about blood pressure a whole lot. So probably the best investment you can make on your health is to go out to Costco or Long's and buy yourself a decent automated home blood pressure cuff and make a habit of recording your blood pressure almost daily, preferably in the morning, because morning is the time you have the highest blood pressure. It doesn't make sense why you wake up, you're kind of tired and it takes time to get going, you feel like your blood pressure is low because you can't wake up. but that's the time you actually have the highest blood pressure. So check your blood pressure then. And then blood pressure is something that can creep up on you. You may have checked your blood pressure with your regular doctor 5 years ago, it was fine. But sometimes later in life, it can just creep up on you and get really high all of a sudden. So make sure you check that every day. And you can use some online app. This is what I used to use. American Heart Association had a website which is being transitioned right now. But I log on and I put my exercise hours and my blood pressure, my weight, and so on. And then I used to do that. And then you can kind of see my 1-year blood pressure trend. It goes up and down based on my stress or lack of exercise and whatnot. But it kind of keeps me in check. Sometimes when my blood pressure went up, I sort of exercised more, cut down my salt, and then changed my lifestyle a little bit, and came down. So it was a nice way to sort of have a feedback system. And I'm going to switch gear and talk about sleep apnea now. How many of you know people around you at home and whatnot who snore a lot, loudly? Probably a lot, right? So they may have obstructive sleep apnea, and they may not know it, okay? And here's a reason why you should get it checked out. A recent study has shown that people suffering from obstructive sleep apnea have much weaker brain blood flow to those without sleep apnea. And this was a study done at UCLA comparing the person without sleep apnea that you see on your right, and then that's the brain MRI blood flow study with someone with sleep apnea on the left. And you can kind of see with the color, the intensity of the green sort of color, that basically the darker the greenish color is less oxygen going to the brain. So that's been shown that sleep apnea alters your blood flow to the brain when you're at, and then that may be the reason why you get more constant chronic wear and tear damage to the brain with the sleep apnea. And this is like a shocking sort of news. Here are other facts. We're learning a lot more about the relationship between sleep apnea and other cardiovascular sort of disease. Here are the scary statistics. Untreated sleep apnea double the risk of stroke, double the risk of sudden cardiac death, increase the risk of cardiovascular mortality by 5-fold. This is like, if everything else is the same, your cholesterol level, your weight, blood pressure, everything is the same, but you have sleep apnea, that's your risk, okay? And we're learning more about what kind of stroke gets increased with the sleep apnea. We talked about different kind of stroke, the clot forms in the heart or in the neck or inside the brain and so on. We're learning more that the sleep apnea increases the risk of the cardioembolic stroke, which is when something happens to the heart and your heart forms a clot and that clot gets dislodged to the brain. And there seems to be some kind of a structural and physiological change that occurs in the heart when you have constant chronic sleep apnea. It's probably because lack of oxygen or low oxygen level constantly causes slow remodeling of the heart, and it changes the structure of the heart and weakens the heart. And as I showed you earlier, if the heart gets stiff or dilated, changes the shape, it can form a little sort of pocket inside the heart that can form a clot, or can cause arrhythmia because it changes that sort of a pacemaker area of the brain, the heart. The ultimate medical treatment for sleep apnea is a CPAP machine, which is something like that you see. But a lot of people may not feel that comfortable. But there are little things that you can do to prevent sleep apnea or minimize the effect, which is lose weight if you're overweight, because a lot of that excess tissue in the back of your throat and the palate can sag down. So if you lose weight, you lose that part, and you may stop snoring. And if you exercise a lot, it tends to help. And also minimize alcohol intake, especially at night before sleeping. And if you quit smoking, that also reduces the risk of sleep apnea. And if you have like chronic seasonal allergy, you can use a nasal decongestant or allergy medication and try to sleep not on your back, but on your side. And I'm not a sleep specialist, so if you feel like you want to get checked out, you should ask the sleep specialist for further recommendation. So those are the medical sort of conditions that you should go see a doctor and get treated. And really what I wanted to talk to you about today is the common lifestyle risk factor of stroke, because the title of the talk is Simple Ways to Prevent Stroke. So little things that you can do every day at home, okay? So first of all, I'm going to just give you the list of topic that I'm going to talk about. So these are the main lifestyle risk factors that can affect the risk of stroke. Diet low in fruits, diet low in vegetables, diet high in sodium, excessive alcohol, which is defined as more than 2 drinks a day, low physical activity or obesity, smoking, and stress. Now, nothing seems so novel. You kind of heard like all these things, but I'm going to give you a little bit more information today that may be eye-opening. So here's the latest sort of ranking of all the risk factors for stroke that was released last year. Number one, so the column here is the ranking of what's important in terms of the stroke risk factors. So number one is by far blood pressure, like I talked about. Okay, number two, surprisingly, is diet low in fruits. Okay, diet low in fruits is more important than a high sodium diet, no vegetables, even more important than smoking or cholesterol level. High cholesterol is way over down here. Number 15, we talk about Lipitor, your LDL, HDL. You know what? That's number 15. And not eating your fruits in the morning is way more important, okay? Okay? And then other things that's probably not relevant to us here in Hawaii is that we're learning that the air pollution can really increase the risk of stroke. And that accounts for a lot of the high increase in stroke in Asia, China, Russia, and so on. Okay? So fruits, that's kind of like a nice news, right? Because personally, it's easy for me to eat fruits than vegetables. You know, fruits, you can just peel the skin and just eat in the morning and it tastes good. Whereas vegetables, you kind of have to like prepare and cook and whatnot. So, you know, the questions I get asked is which fruit and what's the best one, okay? Really, like there's no data like that. And I think eating any of the fruits is just as good, but here's some information because, you know, some people may not believe me when I say fruits is good for you. So here's the list. Okay, berries is very good. Raspberry, blueberry, strawberries, blackberries, I think acai counts as some berries. It has polyphenols, which is antioxidant, and it's been shown to lower the stroke risk. And it's part of the Mediterranean diet, and we all know that berries are very good. Red grapes has I can't even pronounce these, but resveratrol, which helps to keep the platelets. So platelet makes the clot, okay? Platelet sort of clumps the blood together to make a clot. And then red grapes helps to keep the platelets from sticking together. Kind of acts like aspirin. Watermelon has L-arginine, which tends to lower blood pressure. Banana has potassium. And it's been shown that if you eat, it's been estimated that if you eat 3 bananas a day, you can reduce the risk of stroke by 21%, okay? That's huge. Apples has certain phytonutrients which act as antioxidant and fight against LDL. And any of the citrus fruits, orange and so on, has hesperidin, which lowers blood pressure and also increases blood flow to the brain as well. And also contains flavonoids, which lowers the risk of stroke. Guava has lycopene, which also lowers the risk of stroke. And it doesn't mean that any of the fruits that I didn't list here are not important. I saw lychee has some benefits too. So, I mean, I don't think it's limited to this, but it has some scientific basis as to why it works, okay? So now you're thinking, so any other good news? I mean, I'll have to eat fruits, right? I mean, so what are some of the easy things we can do? Who likes to drink coffee? I love to drink coffee. I love it, okay? So, or green tea. Green tea is also good, okay? So it turns out that drinking a cup of coffee per day can decrease the stroke risk by 20%. 20%. Good news for all of us who likes to drink coffee. And then, similarly, drinking 4 cups of green tea has a similar health benefit. You know, so, you know, personally, I'm a big-time black coffee drinker and also take some espresso a day, so this was amazingly good news for me. So, and then surprisingly, drinking coffee has additional benefit of preventing diabetes and also Parkinson's disease. That I kind of knew that from my neurology training, but you know that's been shown over several studies, association between coffee drinking and reducing risk of Parkinson's and also liver cancer. More good news is that eating chocolate, especially dark chocolate, lowers the stroke risk as well. So there was a Swedish study that was published in the Journal of Neurology that studied 37,000-ish men and then looked at people who ate chocolate and quantified how much, like little, a lot, and none, and showed that people who ate the most chocolate in this 10-year study had a 17% lower risk of stroke. Now, it doesn't mean that, you should eat a lot of chocolate. I mean, that's going to cause diabetes and obesity and whatnot. So, what they prefer is dark chocolate with a minimal sugar. And so I think it's good to have a little bit of a chocolate as a snack here and there, and that may actually, reduce your risk of stroke. You don't have to feel guilty about it. And low-fat dairy, so milk, also has been shown to reduce the risk of stroke by 12%. And they postulate that maybe from vitamin D level, but that's speculation. But there is some association that drinking milk is actually good. Sun exposure, I don't think we have to worry about this because we live in Hawaii. But compared to people who have minimal sun exposure, people who had more sun exposure actually had a lower risk of stroke. And it's probably due to vitamin D deficiency issue. And again, just like, chocolate, I mean, this doesn't mean that you should go out there and get exposed and get all burnt every day. I mean, we don't want you to get a skin cancer as well, but a little bit of sun exposure here and there can reduce your risk of stroke, which is good news for us. We have known this for many years. By eating fish over meat has a very strong health benefit because it has omega-3 and DHA, which is the good fat, which kind of like takes the bad fat away from your blood vessel and kind of melt it away and remove it, okay? And also omega-3 or DHA is the building block for the brain. It's been shown, this is kind of a side topic, but if someone's pregnant, it's been shown that eating fish actually increases the verbal IQ of the baby later on in life. So the recommendation is actually for pregnant women to eat some kind of fish, something sort of like low in mercury, like salmon and whatnot. But fish is very good. So in Hawaii, we have many delicious fish cuisines. So this is great news. So I know some of you, maybe some of the men out there, may say, okay, like I'm just gonna go get poke every day and eat this every day. This is good, right? We're gonna reduce the stroke. So the bad news is that salty food is really bad for you as well. So salt increases your blood pressure. And also, even if the blood pressure is controlled, the amount of salt you take increases your risk of stroke regardless. So you can't just say, okay, I'm gonna take, eat the potato chips and poke, I'm gonna take double the blood pressure medication, I'm good, right? It doesn't work that way. And it's been, here you can see that diet high in sodium is number 4 risk factor, so it's pretty important. It's much more important than smoking or cholesterol or eating vegetables. And here's the graph that I want to show you, which is sort of a linear correlation between the amount of sodium you take every day and then the risk of stroke. And this is independent of your blood pressure. Like I said, even if your blood pressure is controlled because you take all these medications, if you keep on consuming salt, you can increase your risk of stroke. And it's been estimated that if you can reduce your salt intake from 10 grams per day to 5 grams per day, that would reduce the risk of stroke rate by 23%. But when you say 5 grams, I'm like, what is that? Like, I don't even know what that means. So how much is a gram of salt? It's only this much. It's only that much. Okay, and American Heart Association recommends no more than like 2 grams of salt a day. That's very small. And they actually recommend ideally 1.5 grams of salt per day, which is a little bit more than that, which is very small. And then, again, the AHA recommends sodium intake of less than 2,300 milligrams or 2.3 grams per day. And then you just have to understand that it doesn't mean that if I don't put sort of a table salt on my food, I'm good. It doesn't work that way. A lot of the processed food that we buy has a lot of sodium already in it. Like, for example, that Caesar dressing, 2 tablespoons of light Caesar dressing here you see has 620 milligrams of salt. Okay, that's very small. And then if you go to McDonald's, you can get a quarter pounder with cheese. That has almost like 1,300 milligrams, almost half of what you're supposed to take per day. And this is not even including the French fries, okay? And even soda has sodium, okay? So a lot of things we buy have sodium already. And most of us probably take more than 5 grams per day easily. Okay, so who in here likes to drink alcohol? You can raise your hand. Okay. So whether it's daily or social drinking, so if you like to drink and you want to know what a doctor would say about drinking alcohol, you would think that I would say don't ever drink alcohol, it's bad for you, right? I would say you can drink alcohol, but no more than 2 drinks per day. That's what I would say to my patient. Here's the data. This is a graph showing that the risk of all-cause mortality, so any kind of like death rate, based on how much drink how many alcoholic drink you consume per day. So compared to people who don't drink alcohol at all, actually if you drink like a half a glass or half a drink or 2 a day, the risk of death actually goes down. It doesn't mean that you should go out and start drinking. That's not what I'm saying. But if you drink like 1 glass of wine or 1 can of beer a day, it's actually not that bad. But if you go above 2, then the risk goes up steadily, and this risk is more prominent among women than men. And we don't really understand why there's that sort of a gender differences, but there is. So if you're a woman and drink more than 2, you got to be careful. And then if you focus on stroke risk, same kind of a U-shaped curve where if you have 1 or 2 drinks a day, your risk of stroke actually goes down a little bit, but it goes up pretty exponentially after 2 or 3 drinks. And that's where the recommendation about keep the drinking less than 2 comes from. Again, I'm not recommending you to start drinking alcohol every day after this talk. Okay. So I want to touch a little bit about power of walking. Of course, you could exercise every day and do something more vigorous than walking. That's even better. But a 30-minute of walking, brisk walking, I'm not talking about just sort of dilly-dallying, talking, and just kind of, it's like nice brisk walking, okay? How that could make a huge difference in your health. And this is not just about losing weight. This is, even if your weight is the same, the health benefit is there, and I want to show it to you. So the studies have shown that brisk walking 30 minutes a day would reduce the risk of stroke and heart disease by 27%. It's been shown to reduce the risk of diabetes and even cancer, and prevents osteoporosis and even dementia, and this number is astonishing. If you walk 30 minutes a day or do more vigorous exercise, you will reduce your risk of developing dementia, like Alzheimer's disease, later in life by 40%. 40%, okay? It's a key to gracefully aging, really, walking every day. And routine walking also fights depression and obviously helps to lose weight and boost your energy every day. And it's been estimated that daily walking, and this is like daily walking starting at like middle age, not like from like young, you can add up to 7 years of good 7 years in your life. Okay. We all know that smoking is bad for you. I don't have to like give a talk about this, but I want to really share that the e-cigarette that you see these kids smoking because they think they're healthier because it doesn't have all these I don't know, I don't even know what they are, but they feel that it's cleaner and it's healthier. We're learning that they're just as bad as the regular smoking and has a similar type of a cardiovascular health effect. So, you got to sort of demystify that concept when you see your kids or nephews and so on maybe doing e-cigarette. Smoking really speeds up this process of atherosclerosis, that breakage of that blood vessel inner wall and the cholesterol buildup, and really sort of like doubles the speed of that. And it's been estimated that it doubles the risk of stroke if you smoke. Last thing I want to talk to you about is the impact of stress on your health. Chronic stress can increase the risk of a stress hormone called the cortisol. It's released from the brain. And there's evidence linking chronic stress and elevated cortisol on the development of a metabolic syndrome. So metabolic syndrome is when you have this constellation of a high cholesterol level, insulin resistance, diabetes, obesity, and all those combinations can lead to sort of various bad cardiovascular effect, including development of a coronary heart disease, high cholesterol, insulin resistance that I talked about, and then elevated high blood pressure. So stress can have a biological effect, as you can see. And one study showed that these are all interesting studies, just sort of trivia, perceived job insecurity, just the perception that, you may lose your job, that stress was associated with a poor health. If everything else was the same, that itself was an independent predictor of poor health. Some of the African American people reported that unfair treatment and discrimination at work had more carotid plaque. So they measured everyone's carotid cholesterol buildup, and people who felt like they were discriminated had a much thicker plaque. And then the more interesting thing is that these people, when they went to a randomized trial, so randomized trial is like you have all these people, not literally, but sort of flip a coin and put one group into the treatment group, the other one is a placebo, so you just sort of do the regular usual care and see the difference in outcome. So they enrolled these people and had them go, and one group did a meditation program, like a hardcore intensive Okay, so the group that did meditation over a 6 to 9 months period had a significant decrease in the carotid cholesterol plaque. They measured the plaque thickness, and it went down on people who did meditation. That's like a biological difference, okay? That's amazing. It's not like, like, are you feeling better overall? It's not like that. Like, they objectively measured the carotid cholesterol plaque thickness and went down. And then, so there was another randomized trial that did the same thing. So they randomized people with a coronary heart disease, so bad heart, and then randomized to this meditation program to a group that just got like a pamphlet of a health education, eat your vegetables and so on, like, control your blood pressure, the paper material. And the end point was looking at a combination of any kind of mortality, so any death, heart attack, myocardial infarction, or strokes. Okay, and they followed them for 5 years. And they showed that statistically there was a significant difference in this endpoint, meaning that the group that went through this meditation program had almost 50% risk reduction in the combination of stroke, heart attack, or death. And that was statistically significant. So that was like a very robust trial. This is like way more powerful than these trials that you hear about Plavix and aspirin or Lipitor and all these pharmaceutical trials. So does this mean that we all have to sort of find this meditation class in Hawaii? I don't think so. I mean, I think that's, too much. I think the main thing is to take away stress, learn to decompress, and, have that sort of peace of mind. And then personally, I don't think we need to sort of go to the meditation class. We live in Hawaii, so we can actually combine relaxation and spiritual session and a bit of sun exposure and exercise all at once. You can go to Ala Moana Beach Park, get a stand-up paddle, and do that, and get everything together. I think the most important thing is to, again, decompress, release the stress, and restore some mental balance every day. So what is the bottom line? So again, simple ways to prevent stroke. I wanted to make it practical and easy for you. So probably the most important thing you can do is to go buy a home blood pressure cuff and measure your blood pressure every day. And if your blood pressure is a little bit elevated, I think you can try to bring it down by exercising more, cutting down your salt intake or alcohol, and do all those little things. And that's going to actually bring it down. You can see it. But if your blood pressure is elevated consistently above 140/90, I think you should go see your primary care doctor and perhaps get blood pressure medication adjusted or started. And also, drink a coffee or green tea in the morning when you wake up. It's good for you. Try to eat plenty of fruits for breakfast and have a small amount of dark chocolate for snack. Try to eat more fish to get your omega-3 and eat more vegetables. And try to minimize your salt intake. Try to go for a brisk walk, preferably outdoor, for at least 30 minutes a day. And if you want to do something more vigorous, that's even better. And at work, try to use stairs and not elevator. And try to keep your alcoholic intake 1 to 2 drinks a day, preferably red wine for its additional health benefit that we know. And try to eat fruits for dessert and not ice cream or cake. And stop smoking, including the e-cigarette. And if you snore, consider getting a sleep study and get treated for sleep apnea. Lastly, learn to have a moment during the day to relax and learn some skills to remove stress from your life. So why do we want to change our lifestyle to prevent health? Some people may have an attitude of saying, I've had a good life, I can go anytime, I have no regrets. I'd rather drink and eat whatever I want and just enjoy life. YOLO, right? You live your life once. But, and it's not about just living one extra day. I mean, life is not about that. So we got to ask yourself, what is your why? This is a slogan from AHA, American Heart Association. Life is why, but we ask everyone to fill that in. Like, what is your why? What is your reason to change? For me, family is why. I'm trying to live a healthier life so that I can take care of my family. See my daughter graduates from college, walk her down the aisle when she gets married, watch her become a mother, and experience being an active and fit grandpa when she has a baby, and being there for my entire family. It's not about me, it's for them. It's not about me living one extra day, because I know that my kids, my grandkids will be a better person if I can be around and be there for them in a fit and non-disabling way, I guess. I know that my daughter and my future kids will become a better person if I'm around for them. And I'm giving this talk tonight because I want you to be healthy, but also for a selfish reason as well. I want to make sure that we change our community into a healthier place, so that when my daughter becomes older, this world, this community would be a much healthier place, and living healthy would become the norm. So thank you for your attention, and at this time, I'd like to take any questions.
Thank you, Dr. Nakagawa. If you have any questions, please raise your hand.
I know you mentioned sleep apnea and stroke. They're related. And if someone had 3 TIAs and minor sleep apnea, is that something you can kind of still? Well, TIAs are kind of mini strokes, and minor sleep apnea is, is there some gauge or would you recommend?
So the question is, if you had a TIA or a mini stroke or like a brief stroke-like event and have a sleep apnea or mild sleep apnea, what should we do? The recommendation is really, if you had any kind of a stroke, even if it's mild symptoms, your risk of stroke is much higher in the future. And if you have any element of sleep apnea, the recommendation is to get that treated. And how to get it treated is sort of a different topic, whether you want to wear that machine or whether you want to change your lifestyle. And I think there is like a mouth guard that you can use or some kind of a surgery as well. Again, I'm not the specialist, but our recommendation would be to get that tested and treated.
Okay, there's a question on that side.
Is it the caffeine in coffee and green tea that's beneficial? What about drinking decaf coffee or decaf green tea?
That's a very good question. So the question is it a caffeine in the coffee and green tea that has the benefit? The answer is no. We don't think it's the caffeine. I don't think the study was done with a decaf. It's just the way they designed the study. But I think it's actually what's in that sort of a it's non-caffeine, like whatever's in that coffee bean, all the nutrients. I don't actually know the actual element, but I think that's the same thing as chocolate.
Okay, thank you. We have a question here.
You said for the high blood pressure, the blood pressure should be 120/80. Is there similar recommendation for the cholesterol, the total cholesterol and the LDL?
Yeah, that would be my weak spot. Total cholesterol should be less than 200, and LDL should be less than 100. That's sort of the standard goal, but I think it's one of those things that lower the better. Yeah.
Do you have a question up there?
Oh, about day you eat the fruit matter?
So the question was, does the time of the day when you eat the fruit matter? I don't think so. I don't think it matters at all. I just said it because that's what I would do.
You mentioned the measurement of the carotid artery. Who is the physician who would do it, and how is it done? Because I went once to someone who did it in Hawaii Kai, and they literally pretty much ran some kind of scan on my carotid artery. Is that the way a professional would do it? This was not a doctor. This was a group, and they measured different functions of your body. But since you had mentioned the measurement of the carotid artery, I'm wondering who does it?
Sure.
And how do they do it?
So the question, again repeating the question, how do you measure the carotid artery cholesterol buildup? 3 ways to measure. You can do it with ultrasound, so like sound wave, or a CAT scan or MRI. The standard is ultrasound. That's easy, non-invasive. And then that can be done, any of those 3 can be done through radiology, or some vascular surgeons have their own carotid ultrasound sort of lab. And if you go to a vascular surgeon, they can do it. But if your primary care can just refer you to get a CAT scan or MRI or ultrasound at any of the radiology sort of facilities.
Okay, we have a question here.
It seems that coffee raises your heart rate. Does it also raise your blood pressure? Is there a relationship?
So the question was, the coffee may raise the heart rate and blood pressure. So isn't that harmful? And like how do we interpret that? I think the caffeine in the coffee can potentially raise the heart rate a little bit, but I don't think it's that significant personally to the level where it causes harm, and also for the blood pressure as well. I think if you have hypertension, like really blood pressure disorder, perhaps the caffeine intake can augment that blood pressure. But if you have a blood pressure that's controlled with a medication or a lifestyle, if you have a healthy lifestyle and you don't have high blood pressure issue, I don't think the caffeine in the coffee will augment the blood pressure to a harmful level. So personally, like 1 or 2 cups of coffee doesn't do any harm in terms of the heart rate and blood pressure.
You'd mentioned about the low-fat dairy, but recently I heard that just full-fat dairy was better in general than low-fat or non-fat dairy.
That may be true. I'll admit that I'm not the expert in that sort of diet world of milk, and that may be true. Maybe whole milk may have other benefit. The study I found specific to stroke risk was done in the low-fat milk.
Okay, thank you. We have a question here.
I read where some Japanese scientists have found that natto is excellent for breaking blood clots. What are your thoughts on that?
I love natto, but I don't know much about the science behind it. I should read up on that. Thank you for bringing that up. But I have heard that many times in Japan.
Other questions? Please raise your hand.
To know what are the symptoms of, I always hear about mini stroke.
Mm-hmm.
So what would make you be aware that someone is having or had a mini stroke?
That's a good question. So the question is, what is a mini stroke, and how do you know if someone had a mini stroke? There are 2 types of mini strokes. The traditional one is called TIA, or transient ischemic attack. And classically, that's when you have a very brief episode of stroke-like symptoms. So suddenly, you may start to slur your speech, or you have a facial droop, your arm or hand may get weak or clumsy, may last for like a few minutes and then goes away. So that's the sort of a typical TIA, or transient ischemic attack, or mini stroke. That's when there was a blockage that happened, that part of the brain wasn't working, but for whatever reason, the blood clot just kind of broke up into pieces on its own and restored blood flow by itself. And so, the symptom only lasted for a few minutes, and the brain can handle that kind of a blockage. A few minutes, 5 to 10 minutes, that part of the brain doesn't get permanently damaged. So when you restore blood flow, then that part of the brain starts to work again. But that's a warning sign that if you don't do anything about it, there may be a big stroke coming. There's a much higher risk of having another stroke in the next 48 hours if you just leave it alone. That's why if you have a mini stroke or TI, like a little spell, you should come to the hospital and get checked out because you may have a big clot sitting in your heart or in your neck that's about to go into the brain. Okay. The second type of sort of mini stroke or silent stroke is you don't have any symptoms at all, and then for whatever reason you get a brain MRI or CAT scan for some other reason. Let's say you have a constant headache and your doctor says, why don't you get a brain MRI? And the brain MRI didn't show any tumor or anything like that to cause headache, but they noticed all these little mini sort of scars in the brain that looks like a small little stroke that happened in the past. And then when that stroke happened, you probably didn't have any symptoms, or you may have had that little spell while you were sleeping. You couldn't even have a symptom because you were sleeping, okay? And then, so that indicates that, wait a minute, you didn't have a clinical symptoms before, but the MRI looks like you had these little small strokes in the past. And that may sort of, that's one way that the doctor may say, hey, your MRI looked like you had a mini stroke before. Okay.
Thank you. We have a question here.
For the fruit in the study that you cited, was it whole fruit, raw, or was it canned fruit, or was it juice? Like, you know, if the difference between canned orange slices and orange juice.
Yeah, so I know a lot of people want to ask all those questions. Because the way the study is done to survey 30,000 or 50,000 people, I think they can't go into that level. They simplify, do you eat fruits at all? How many days a week and so on. So it never has that kind of detail. That's my honest answer. But some people may say, if you take vitamin pills, has everything in it, is that good enough? No, the answer, it's been shown that vitamin pills don't do much. It's actually eating the actual fruits that matter. Whether you slice it or mix it or smoothie it, I don't know. I think smoothie is just as good.
Does your blood pressure change over as you age? Like the standard, I guess, is 120/90, but should it change as you age?
Okay. So the question is, so I believe the question is, should the target blood pressure change as we age? Is that the question? Yeah. So that's a very, very controversial topic. Half the people think yes. Older people should have a little bit of a sort of a higher blood pressure, being generous, and then that's why the recommendation got looser recently. Okay, the blood pressure goal used to be much tighter, and then the new recommendation came out a few years ago that made it looser to make it a little bit high, especially for older people. And then last year, a different study came out that really showed that 120 or less had much better outcome. And I personally believe the lower the better, because you saw that linear relationship. Even 140 and 120, the difference is clear. So I firmly believe that the future guideline is going to make it tighter, but the current guideline, if you ask me, is yes, the older people can have a little bit of higher blood pressure, like 140 is okay.
Okay, we're going to take one last question here.
Do you know if, they sell these supplements in the Costco, like grape seed with resveratrol or bioastin, things like that. Do you know if they reduce your blood pressure?
I don't know. The thing is, all these supplements, they can sell without doing any kind of studies, and they can claim the potential effect. So there may be effect, but it's never been studied or proven. So I can only show you what's been proven is to eat fruits.
Okay, thank you, Dr. Nakagawa. Let's give him another round of applause. I want to also say mahalo to our Queens volunteers, Steve and Karen. Let's give them a round of applause as well. Karen right here She recently won our Ho'omau Award. She has served Queens for 25 years, and she started when her father came here for colon cancer. And she said she really appreciated the way the doctors, the nurses, the staff, and the volunteers treated her. And so because of that, during that time, she was working at as a dental assistant, and her Thursdays were her days off. She came to Queens to serve. And her father became a colon cancer survivor and then passed away at 93 of old age. So it's people like Karen, it's like Steve, Dr. Nakagawa, how they share with the community and give back that really touches my heart and makes me feel so proud to work here at Queens. And I'm so glad that you guys were all here to be a part of it, because it's really reaching out to the community that makes a difference for all of us here. So thank you. And our next lecture for June is called What's in Your Genes? How Genetics is Changing the Cancer Equation. And everyone probably knows about Angelina Jolie, how she had a double mastectomy in advance because she found out that she had a genetic mutation that gave her a predisposition to breast cancer. So we're going to have 4 specialists talking about the genetics, the role genetics plays in cancer, and also how it is being used in the fight against cancer. We have Dr. Christopher Lum, who is the medical director of the Queens Molecular Diagnostics Biorepository Laboratory. We have 2 certified genetics counselors, Allison Taylor-Tchaikovsky and Christina Silas. We also have Christine Kroom, who is the manager of Queens Pathology and Molecular Diagnostics Biorepository Laboratory. That's coming up Wednesday, June 28th, going to be from 5:30 to 7 p.m. right here. I want to let you know also that get your parking tickets validated with Erin outside. If you can turn in your evaluation forms, and if you have those stroke surveys, that would be really appreciated. I want to thank you for attending this evening. Have a good night and drive safely.